Dr. Fagbemi will now discuss the role of endocrine therapy and medical therapy for prostate cancer.
Thank you. As earlier mentioned, the focus of this presentation is on the role of radical prostatectomy, specifically the use of robot-assisted surgery. But for completeness, we're going to talk briefly about patients in whom this modality would not be appropriate or who will eventually need this kind of intervention. As a medical oncologist, my involvement with management of prostate cancer will be mainly in this group of patients, though often one is called to help advise patients in making decisions on their own. Metastatic disease refers to conditions in which the prostate cancer itself is known to have spread beyond the prostate and therefore considered incurable using the treatment options previously described by the other speakers. Because of the benefits of screening and improved access to care, these patients constitute about 5% of patients with prostate cancer at the time of original diagnosis. However, quite a substantial number of patients eventually develop metastatic disease and therefore will be appropriate candidates for this problem, for this intervention, either after initial therapy, such as after radical prostatectomy, or after a period of observation. It's important to note that prostate cancer is amenable to the use of hormonal manipulation because the prostate itself, as a male organ, is dependent on the male hormone for its nurture. The source of this male hormone is the testis, and the production of this male hormone called testosterone is dependent on information provided by an organ that resides in the brain. Therefore, in patients who are considered as suitable candidates for the use of hormonal therapy, the approach that we take is to deprive the prostate and subsequently prostate cancer of this male hormone. One option is to remove the testis. Another option, of course, is to, in a way, deceive the brain into assuming that the patients have more than enough testosterone, and this is achieved by the use of agents that are injected, essentially. Also, patients who have failed this modality of treatment can, of course, proceed to a situation where they receive conventional chemotherapy, which kills cancer cells and sometimes injures other cells. The use of orchiectomy was the original intervention that was applied in the past. Of course, for various reasons, it does not have universal acceptance among men. Everybody is afraid to lose something. So the ability to give medications to achieve the same objective is very, very important. Numerous drugs are used. There are about 3 that are in popular usage. One is called Lupron. The chemical name is Luprolide. Another alternative is Zolodex, which Dr. Olds did mention earlier on. The chemical name is Goserelin, and most recently, another agent called Tresla has been approved. When these drugs were originally developed, they were given every day, very inconvenient, but with improvement in ability to deliver them, they can be administered once every year now with implantation. Another approach is to interrupt the ability of this male hormone to actually affect the prostate cancer itself. And the agents that are used are fortunately administered orally. An example is a drug called Kesodex, which is given daily. There are other members of that same group. These agents can be used alone, but more popularly, they are used in combination with either removal of the testes or with the agents injected as previously mentioned. I would mention the role of estrogen, which is available and also are used in the past, though not anymore because of side effects. Estrogen works again by deceiving the brain into giving an impression that there is more than enough testosterone available. Therefore, the testis is not driven to produce testosterone. There's a drug called ketoconazole, which is an antifungal agent, which also manipulates the ability of the body to make testosterone. And sometimes patients are given ketoconazole. I must mention, however, that this drug will be used only after the ability to interrupt testosterone production has failed. because of the side effects associated with its use.